At some point in many long-term relationships, something subtle begins to shift. It's rarely dramatic at first. There's no single moment where everything changes. Instead, it shows up quietly in the spaces between routines, in the way bedtime becomes just sleep, in how intimacy slowly becomes less frequent, less urgent, or even something to avoid. For many people, this change is confusing, sometimes frustrating, and often deeply personal, and yet it's far more common than most realize. What makes this experience particularly complex is how easily it's misunderstood. When sexual desire fades or intimacy becomes inconsistent, people often search for explanations outside themselves. They may assume their partner has lost interest, that stress is to blame, or that the natural aging process simply means this is how things are now. These explanations can feel logical, even comforting in a way, because they don't require looking inward. But they can also prevent someone from recognizing what may actually be happening beneath the surface. In many cases, especially for women, changes in sexual desire are not simply about relationships or external pressures. They're deeply connected to biology, to the brain, and to the body's shifting hormonal landscape over time. The challenge is that most women are never taught to think about their sexual health in these terms. Unlike other aspects of health like heart disease or diabetes, sexual well-being is rarely discussed openly and even less often explained in a clear, science-based way. This lack of awareness creates a gap. People feel something is different, but they don't have the language or framework to understand it. Instead of recognizing a potential medical or physiological issue, they may internalize the change or misattribute it entirely. A woman might think, maybe I'm just not interested anymore, or maybe this is what happens at my age. In reality, her body and brain may be undergoing changes that are both identifiable and treatable. One of the most important and often overlooked truths about sexual health is that it evolves throughout life. Just as energy levels, sleep patterns, and metabolism shift over the decades, so does sexual function. But unlike those other changes, this one carries emotional weight. It's tied to identity, connection, confidence, and relationships. When something feels off in this area, it can ripple outward, affecting not just physical intimacy, but also communication, self-esteem, and partnership dynamics. Consider a couple who has been together for decades. They've built a life, shared experiences, and developed a deep emotional bond. From the outside, everything may appear stable and fulfilling, but inside the relationship, intimacy may have quietly diminished. One partner might feel rejected while the other feels pressure or confusion. Neither may fully understand why things have changed, and without open communication, assumptions begin to fill the gaps. This is where many people find themselves stuck, not because there are no answers, but because the conversation never begins. Sexual health has long been treated as something private to the point of silence. Even within medical settings, patients are often asked only the most basic questions, if at all. And when they are asked, the questions may not go far enough to uncover the real issue. For women in particular, this silence is compounded by a lack of education about their own bodies. Many grow up without learning the names or functions of their anatomy in a meaningful way. This might seem like a small detail, but it has significant consequences. If someone cannot clearly describe what they're experiencing, it becomes much harder to seek help or even recognize that help is available. The result is that many women navigate changes in their sexual health alone, often believing they're the only ones experiencing them. They may normalize discomfort, dismiss low desire, or assume that dissatisfaction is simply part of long-term relationships. Over time, this can lead to a sense of disconnection, not just from a partner, but from oneself. And yet, the reality is far more hopeful. Sexual health is not a fixed trait that disappears with age. It is dynamic, responsive, and, in many cases, improbable. There are women in their 60s, 70s, and beyond who report deeply satisfying and fulfilling sex lives, not because nothing has changed, but because they've adapted, learned, and, in some cases, sought the right support. This challenges a common cultural narrative that intimacy belongs primarily to youth. In truth, desire and pleasure do not have an expiration date. What changes is how they are experienced and what is needed to support them. For some, that may involve understanding hormonal shifts. For others, it may mean addressing physical discomfort, exploring new forms of intimacy, or simply having more open conversations with a partner. It's also important to recognize that changes in sexual desire are not a reflection of someone's worth or attractiveness. They are often rooted in biology and physiology factors that can be influenced, managed, and sometimes treated. When viewed through this lens, the conversation shifts from blame or frustration to curiosity and problem solving. One of the most powerful steps someone can take is to become informed. Understanding that the brain plays a central role in sexual desire, that hormones influence not just physical readiness, but also interest and motivation, and that these systems can change over time, this knowledge alone can be transformative. It reframes the experience from something mysterious or personal to something understandable and, importantly, addressable. Equally important is the role of communication. Many couples avoid discussing intimacy because it feels awkward or vulnerable. But without these conversations, misunderstandings can grow. A partner may interpret low desire as rejection, while the other feels pressure or guilt. Opening the door to honest dialogue, even imperfectly, can begin to bridge that gap. What often emerges in these conversations is a shared desire for connection, even if the path to that connection has become unclear. This is where education, medical guidance, and sometimes therapeutic support can make a meaningful difference. When both partners understand that changes in sexual health are common and often treatable, it becomes easier to approach the issue as a team rather than as individuals on opposite sides. Ultimately, the goal is not to return to some earlier version of intimacy, but to create a new one that reflects the present reality of the body, the relationship, and individual needs. This may look different from what came before, but it can still be deeply satisfying and meaningful. As we move forward, it becomes essential to look more closely at what's happening beneath the surface. What exactly causes these changes in desire? How do hormones, the brain, and the body interact to shape sexual experience? And perhaps most importantly, what can be done when things no longer feel the way they used to? These are the questions that open the door to understanding and to reclaiming a part of life that is too often quietly set aside. To understand why sexual desire and satisfaction can change over time, it helps to look beneath the surface beyond assumptions about stress or relationship dynamics and into the biology that drives these experiences. Sexual health is not just about physical function, it is deeply rooted in the brain, influenced by hormones, and shaped by the body's ongoing changes across the lifespan. One of the most important concepts to grasp is that desire does not originate in the genitals. It begins in the brain. The brain acts as the control center for sexual interest, arousal, and motivation. It processes signals from hormones, emotions, environment, and past experiences, and then translates those signals into what we perceive as desire. When this system is functioning smoothly, a person may feel spontaneous interest in intimacy or respond positively to a partner's advances. But when something in that system shifts, desire can become less frequent, less intense, or absent altogether. For many women, one of the key contributors to this shift is a condition known as hypoactive sexual desire, or HSDD. This is not simply a matter of not being in the mood. It is a recognized medical condition characterized by a persistent lack of sexual interest that causes personal distress or relationship strain. What makes HSDD particularly challenging is that it often goes unrecognized. Many women assume their experience is normal or attribute it to external factors, never realizing there may be a biological component. Hormones play a central role in this process. Throughout life, hormones such as estrogen, progesterone, and testosterone influence not only reproductive health but also sexual desire, arousal, and comfort. As women approach midlife and transition through menopause, the levels of these hormones begin to change, sometimes gradually, sometimes more abruptly. These shifts can affect multiple aspects of sexual function at once. Estrogen, for example, is crucial for maintaining the health of vaginal tissue. It supports blood flow, elasticity, and natural lubrication. When estrogen levels decline, the vaginal tissues can become thinner, drier, and more sensitive. This condition, often referred to as genitourinary syndrome of menopause, can make intimacy uncomfortable or even painful. Over time, as sex becomes associated with discomfort, the brain may begin to suppress desire as a protective response. Testosterone, although often thought of as a male hormone, is also important for women. It contributes to sexual interest, energy levels, and overall sense of vitality. When testosterone levels decrease, some women notice a significant drop in desire, even if other aspects of their health remain stable. This can be particularly confusing because outwardly, nothing may seem wrong, yet internally, the motivation for intimacy has changed. What's important to understand is that these hormonal changes don't happen in isolation. They interact with psychological and relational factors, creating a complex, interconnected system. For instance, a woman experiencing vaginal dryness may begin to anticipate discomfort during sex. That anticipation alone can reduce arousal, which then reinforces the physical issue. Similarly, if a partner misinterprets reduced desire as rejection, it can create tension in the relationship, further complicating the situation. Another layer to this complexity is how individuals interpret their experiences. Many women, even those who are highly educated or health conscious, may not immediately consider that their own body could be the source of the change. Instead, they may focus on their partner's behavior or assume the relationship itself is the problem. This misattribution can delay diagnosis and treatment, allowing the issue to persist or worsen over time. It's also worth noting that sexual function is not static. It can fluctuate even within the same person. Stress, fatigue, emotional state, and life circumstances all play a role. A demanding work schedule, caregiving responsibilities, or health concerns can temporarily reduce desire. In these cases, the change may be situational and reversible. However, when low desire persists over time and causes distress, it's important to consider underlying medical factors. Pain during sex is another critical issue that often goes underreported. Many women assume that discomfort is something they simply have to tolerate, especially as they get older. But pain is not a normal or acceptable part of sexual activity. It is a signal that something in the body needs attention. This could be related to hormonal changes, as mentioned earlier, but it could also involve nerve sensitivity, pelvic floor muscle tension, or other conditions that require evaluation. One of the challenges in addressing these issues is that they are rarely discussed openly, even in healthcare settings. Patients may feel embarrassed to bring them up, and clinicians may not always ask the right questions. A simple yes or no question about sexual activity does not capture the full picture. Understanding sexual health requires a more nuanced conversation, one that explores not just whether someone is sexually active, but how they feel about it, what their experiences have been, and whether there are any barriers to enjoyment. When these conversations do happen, they often reveal patterns that were previously hidden. A woman might realize that she has been avoiding intimacy, not because she doesn't love her partner, but because she subconsciously associates it with discomfort or obligation. Another might recognize that her lack of desire began around the time of a major hormonal shift, such as menopause or starting a new medication. These insights can be incredibly empowering because they provide a starting point for change. Treatment options vary depending on the underlying cause, but they often involve a combination of approaches. Hormonal therapies may be used to address deficiencies, helping to restore balance and improve both physical comfort and desire. Non-hormonal medications can also play a role, particularly for conditions like HSDD, where brain chemistry is a key factor. In addition, localized treatments such as vaginal therapies can improve tissue health and reduce pain. Equally important is the role of therapy and education. Sex therapy, for example, can help individuals and couples navigate the emotional and relational aspects of sexual health. It provides a space to discuss concerns openly, learn new ways of connecting, and address any psychological barriers that may be contributing to the issue. When combined with medical treatment, this holistic approach can be particularly effective. It's also essential to dispel some common myths that can prevent people from seeking help. One such myth is that using lubricants or sexual aids indicates a problem. In reality, these tools are simply ways to enhance comfort and pleasure. They can be beneficial at any stage of life and are often recommended as part of a comprehensive approach to sexual health. Another misconception is that desire should always be spontaneous. While that may be true for some people, many experience what is known as responsive desire, where interest in sex develops in response to stimulation or emotional connection rather than appearing cavarice, midazzira, midazvit. Understanding this distinction can relieve pressure and help individuals approach intimacy in a more flexible, realistic way. As the science of sexual medicine continues to evolve, it is becoming increasingly clear that these issues are both common and treatable. What was once poorly understood is now the subject of ongoing research, leading to new therapies and a deeper understanding of how the brain and body interact. However, access to this knowledge remains uneven, and many people are still navigating these challenges without guidance. This is why awareness is so important. Recognizing that changes in sexual health are not just in your head, but are influenced by real, measurable factors can shift the entire perspective. It opens the door to seeking help, exploring options, and ultimately improving quality of life. As we move into the final chapter, the focus will shift toward practical application, how to take this understanding and translate it into meaningful action. Because while knowledge is powerful, it is what we do with that knowledge that truly makes a difference. Once you begin to understand that changes in sexual health are not random or purely emotional, but instead influenced by biology, hormones, and the brain, it becomes much easier to approach them with clarity rather than confusion. And from that place of clarity, practical steps start to feel less overwhelming and more achievable. One of the most meaningful shifts a person can make is moving away from silence. For many, sexual concerns remain unspoken for years, sometimes decades. That silence often comes from embarrassment, uncertainty, or simply not knowing where to begin. But the reality is that sexual health deserves the same attention and openness as any other aspect of well-being. When conversations begin, whether with a partner, a healthcare provider, or even within oneself, they create space for understanding and change. In relationships, communication becomes the foundation for rebuilding or maintaining intimacy. This does not require perfect wording or a perfectly timed conversation. It can start simply, with honesty. Saying something like, "I've noticed things feel different for me," or "I want us to feel close again, but I'm not sure where to start," can open a door that may have been closed for a long time. These conversations often reveal that both partners have been carrying assumptions, one feeling rejected, the other feeling pressure, without realizing they were experiencing the same situation from different angles. It is also important to redefine what intimacy looks like. Many people grow up with a narrow understanding of sex, often centered around performance or a specific sequence of events. But intimacy is far broader than that. It includes touch, connection, shared moments, and emotional closeness. For some couples, especially as they age, shifting the focus from performance to connection can relieve pressure and create a more relaxed, enjoyable experience. Planning intimacy is another idea that can feel unfamiliar at first, but is often incredibly helpful. In earlier stages of life, desire may feel spontaneous and effortless. Over time, with responsibilities, stress, and physical changes, spontaneity may decrease. That does not mean desire is gone, it may simply need a different kind of support. Setting aside time for intimacy, creating an environment that feels inviting, or even preparing mentally and emotionally can make a significant difference. Rather than making intimacy feel forced, planning can actually make it more intentional and fulfilling. At the same time, it's essential to give yourself permission to experience variability. Desire is not constant, and it does not need to be. There will be times when interest is higher and times when it is lower. This fluctuation is normal. What matters more is whether the overall pattern feels satisfying and whether there is openness to adapting when it does not. From a physical perspective, addressing discomfort should always be a priority. Pain during intimacy is not something to tolerate or push through. It is a signal from the body that something needs attention. Seeking medical guidance in these situations can lead to solutions that significantly improve comfort and, in turn, restore a sense of ease around intimacy. When the body feels safe and supported, the mind is far more likely to respond with interest and engagement. Equally important is the role of self awareness. Understanding your own body, your preferences, and your responses can transform the way you experience intimacy. This includes recognizing what helps you feel relaxed, what stimulates desire, and what may be getting in the way. For some, this might involve exploring different types of touch or stimulation. For others, it may mean addressing stress, fatigue, or emotional factors that are affecting their overall well being. There is also value in letting go of unrealistic expectations. Cultural messages often suggest that sex should always be exciting, effortless, and perfectly synchronized between partners. In reality, even the healthiest relationships include moments of awkwardness, misalignment, or simply average experiences. Not every encounter needs to be extraordinary. In fact, accepting that some experiences will be just okay can reduce pressure and make space for more genuine connection. When it comes to tools and support, it's helpful to approach them with openness rather than judgment. Lubricants, for example, are not a sign of failure. They are a simple way to improve comfort and pleasure. Similarly, devices or aids designed to enhance stimulation can be integrated into intimacy in a way that feels natural and collaborative. These are not replacements for connection, they're additions that can enrich it. For those experiencing persistent changes in desire or satisfaction, professional support can be transformative. A healthcare provider who is knowledgeable about sexual health can help identify underlying causes and discuss appropriate treatments. This might include hormonal therapies, medications that address brain chemistry, or localized treatments that improve physical comfort. At the same time, working with a therapist who specializes in sexual health can provide tools for communication, emotional connection, and navigating any psychological barriers. It's also worth emphasizing that seeking help is not a sign that something is wrong with you as a person. It simply means that a part of your health deserves attention, just like any other. The earlier these conversations happen, the easier it often is to address the issue before it becomes more deeply ingrained. Another powerful step is education, not just for yourself, but within families and communities. Teaching younger generations about their bodies in a clear, respectful, and accurate way can change the way they approach their health for the rest of their lives. When people grow up understanding anatomy, function, and the normal variations of experience, they are far more likely to recognize when something changes and to seek help without shame. Over time, these individual actions contribute to a broader cultural shift. The more openly sexual health is discussed, the less stigma surrounds it. This creates an environment where people feel empowered to ask questions, share experiences, and support one another. It also encourages the medical community to continue advancing research and improving care in this field. Perhaps the most reassuring truth is that it is never too late to address sexual health. Whether someone is in their 30s, 50s, or 70s, the potential for connection, pleasure, and intimacy remains. The path may look different at different stages of life, but the destination of fulfilling and meaningful experience remains within reach. In the end, sexual health is not just about physical function. It is about quality of life, emotional connection, and a sense of wholeness. When it is nurtured, it can enhance relationships, boost confidence, and contribute to overall well being. And when challenges arise, they are not the end of the story, they are an invitation to understand, adapt, and rediscover what is possible. By approaching this topic with curiosity instead of judgment, with openness instead of silence, and with knowledge instead of assumption, it becomes something far less intimidating and far more empowering. And that shift, more than anything, is what allows people to move forward, not just accepting change, but actively shaping their experience in a way that feels right for them.